why WNPR was interested in taking on health disparities.
We have so many places where people in Connecticut are doing very well, but we're very interested in finding out more about how people live in areas like the north end of Hartford, just a few blocks from here, and what we and others can do to help their circumstances be a little bit better, whether it's their health outcomes, whether it's their educational outcomes, or just their lives. And that's really important to us, especially being here in the city and wanting to be good citizens here. But I think it's also very important that we get out and address the community at large. Public radio has a broad, diverse, interesting audience, but we don't do enough to reach out to communities of color. We haven't done enough to reach out to some urban neighborhoods in the way that we perhaps could. That's the only way we can really tell these stories, by talking to real people whose lives are being affected. And that's the big thing we're going to do. Of course, we're also going to be telling stories on Morning Edition and All Things Considered that will have our reporters out in the field talking with experts, talking with real people, getting into neighborhoods and trying to find some answers.
So tell me about systems change. Which systems do you envision changing, and how do you think they'll change?
We're not an advocacy organization. We're a news organization. So we're not going to be out there advocating for specific change or specific systems to change. But here's what we can do and what we hope to do. We've got a very smart, very influential audience. A lot of the audience is right up there down the street at the Capitol, and they listen to us every single day. They listen to my show, they listen to Colin McEnroe's show, they listen to Morning Edition. And those people can make a change. They can make a change in laws. They can make a change in the focus that the state has on certain issues. And when we tell stories on our air about health disparities, when we tell stories about health care for the people of Connecticut, these people are listening, and hopefully they'll be able to make a change. That's where I think we can have the biggest impact.